All right, we are back live. This is Senate Health and Welfare. We are back looking at our proposal amendment for H 481. And Katie, if you could just put it up on the screen and we can see what it looks like. Hopefully, finally.
Is it posted?
It is
It's also posted? Okay.
It's posting it now.
So draft 2.1.
No, I think it should be 3.1.
Just draft 3.1, it will be appearing momentarily.
Can you put it up?
Yep, I'm waiting for it to get
Oh,
posted.
Gotcha. I feel like Star Trek.
You feel like Star Trek?
Yeah, I got my tablet. The controls. It's Friday.
Hold on.
It is Friday.
As soon as the website is updated, we should be good to go.
You have a very good poker face. You can.
Which draft is
Never
it?
mind.
It'll be
Kate?
3.1.
3.1.
Okay,
we don't
make a reference.
Keep refreshing them.
We are just waiting on the site.
Okay.
Okay, should I just pull it up from,
I'm just gonna email it to everyone.
I'll just pull it up
Busy.
from Word document.
We're on the floor at 11:30, right?
Yeah, it's gonna be a long one.
Oh, really?
We have a lot of appointments. We have controversial bill. We have other things.
S 2:30,
H2.
H 2:30.
Okay,
Yes, yeah.
here, I'll just share this
Oh, good. Okay, here we are.
from the Word document. Okay.
And it is posted now.
Oh, of course. So our first instance of amendment has not changed. This was reorganizing the sentence to include service members, veterans, and their families. The second instance of amendment has not changed. This was adding the sentence, the plan shall consider emerging research on factors contributing to suicide. The third instance of amendment has not changed. This is including after-school programs to the list and subdivision A1. The fourth instance of amendment has not changed. This is adding to the school model protocol language that ties into the youth well-being grants from last year and ensure that school employees receive education pertaining to the prevention of use of language regarding an identification of eating disorders in youth. And then our fifth instance of amendment is the same, except for the last sentence. This model protocol shall consider the recommendations of the report required pursuant to 2002 Acts and Resolves number 115, section 13. And that is it.
Okay, comments, questions? Is that last part? Okay.
It's good.
We'll go with that.
Well done.
It's a start. All right.
Yeah.
And to Kate, Terry LaValle. We're getting ready to make a motion to vote on the amendment that you just looked at, and I hope that it'll help you and that we can move forward. Okay, thanks.
Thank you. I think it is definitely a step in the right direction with system developments.
Thank you. Thanks for your comment. Okay, so committee, is there a motion to be made at this point?
I move that we amend H 481 as passed by the House with draft of the health and welfare amendment.
Okay,
Okay, I will second the motion. Any discussion? Okay, so we will vote on the amendment draft 3.1 of H 481. Senator Gulick votes yes. Senator Hardy?
Yes.
Senator Williams?
No.
Vice Chair Weeks?
Yes.
And Chair Lyons?
Yes.
Okay, vote is 4-1-0 in committee.
All right.
And now we'll do, we'll vote, or do I have a motion?
Bill as amended, H
481.
481 as amended by us.
Fantastic. I will second the motion. And is there any discussion to be had? Seeing none, Senator Gulick votes yes. Senator Hardy?
Yes.
Senator Williams?
No.
Vice Chair Weeks?
Yes.
And Chair Lyons?
Yes.
And that's 4-1-0 in committee. And who would like to be the reporter on H 481?
So we have 481 and we have 171. So would someone like to report 481?
I'll do 480 unless you want to do.
No, I don't feel strongly enough about 41. I feel it's kind of a superfluous bill, but I voted for it, but I really don't want to be the reporter.
Okay, I'm happy
So-
to report that one. I'd rather not do 171 because I have a lot of other complicated bills on my plate.
So do I, but I get it.
Your
So-
chair.
No. Would you like to do that, Senator Hardy?
Uh,
Report on-
481, sure.
Okay, that's fine.
Hi.
Oh, welcome. We have visitors. Terrific. Oh, we'll take a minute to introduce your visitors. in
Thank
just a minute.
you.
So, while are we waiting for 171?
You are, they're going back and forth on that one instance of amendment and how to get the wording right. So it could be something that you just vote on in concept, and I can continue to fine tune the specifics of how to get to where you want to land, if you feel comfortable with that.
Okay, does the committee feel comfortable with that? I think we went through the proposal amendment. Which section of
The
one?
caregiver piece.
Yes.
We're kind of talking at crosshairs and they're pretty busy, so the responses are sort of far and few in between.
Okay.
So if you want to vote,
The designated language and where it belongs.
yeah,
Okay.
well, sort of. I don't know why it's as complicated as it is, but
Okay.
we're trying to get rid of A and have
Oh,
B
gotcha.
and C be the new A and B.
Yeah,
So, if you want to do that, you could vote pending editors, markup of that instance.
we could do that. And knowing that we're ending at 11:30 and Eric is here to go through S36 with us. It's up on the notice or on the calendar from the House. Let's just, are you able to stay in
I'm
committee?
not, I'm gonna, I can stay until 11:10, but I have a hard stop.
Let's see where we get to by 11:10.
Okay.
We'll bring Eric up and we will hold off on a vote until 11:10, and then we may go ahead and do as you suggested.
Okay.
It's editing, it's wordsmithing. Okay, Eric, thanks for being here.
Sure.
So before we begin, and we're finished with 481, Terry, so you're welcome to stay or not. That's good. Thanks for being here. So we have guests and we'd like to say hello.
Hi, everyone. This is my daughter, Merritt, and my husband, Matt.
Nice to meet you.
It's the last day of school break, so.
Oh, terrific.
Yay.
Wow, we are so lucky to have your mommy in here. She is very important to us.
Absolutely.
And thank you for letting her be here with us. It's great. It's really great. And Matt, you too. Ah, okay. Oh, that's awesome. You need the other.
You look very pretty today.
So Eric's, we have S-36, which is the Violence in Healthcare Facilities Bill. That's come back to us from the House with proposals of amendment, and I've been through it and I've talked with some folks about it. So why don't you go through it with us and then we'll see where we get to.
Yeah.
It is up there for us to concur or make changes or ask for conference.
Yes. Good morning, everybody. Eric Fitzpatrick with the Office of Legislative Counsel. Nice to see you. As the chair was mentioning, I'm here to chat a little bit with the committee about some proposed changes that the House has made to S-36. And as you were mentioning, Chair Lyons, I think this is on the calendar, Senate Judiciary also looked at this yesterday, and they've got one proposal of amendment, which I'll get to in the course of me talking about what the proposed changes are from the House. So you recall, as the chair mentioned in the beginning, this bill generally was about crimes against healthcare workers in healthcare facilities, right? And there was a couple of different pieces to that, but that was the big picture of what it was about. It added a few provisions to the rule in the rules of criminal procedure that permits warrantless arrests outside of the presence of a law enforcement officer, did a couple of other things as well. It also had a piece in there related to HIPAA, the federal health privacy law. You may recall that piece that required healthcare workers, or at least representatives of healthcare facilities, to let law enforcement officers know information that would provide that a patient was medically cleared before they removed the person from the facility. Remember, that was an issue that was concerned both by law enforcement officers that they wanted to be reassured that the person wasn't going to deteriorate in their condition if they got removed. And there was also a HIPAA provision that prevented healthcare providers from disclosing that information. So you guys put in some information to require them to disclose it, which essentially permits them to do. So that was the big picture of it left here. What are the changes that the House made? First of all, there's 4 or 5, but just based on the general description I just gave you. Remember, as it left here, it applied to healthcare workers specifically. House expanded it to include emergency medical providers. So we're not only reply to crimes against healthcare workers, would be crimes against emergency medical treatment providers. And that's why, I don't know if you have this document, I sent it to Alex, I know he put it up on the website. There's a document that shows where the highlights are, right? Shows the changes. So the very first one, if you look at the first page, reflects what I just said. They proposed to change the title of the bill to crimes against healthcare workers at hospitals and against emergency medical treatment providers. So that reflects the point that I just made, which is that that's one of the ways in which the bill was changed, not just healthcare workers, but EMT folks as well. So that's change number 1. Additional change is that when it left here, it applied, as I mentioned, to crimes against healthcare workers in healthcare facilities. They changed that to hospitals. So you can think of the 2 changes I just described. One broadens it, one narrows it. Right? Broadens it in one way by expanding the universe of people it applies to, narrows it in another way, hospitals only. There was concern upstairs about whether it would apply to nursing homes and other situations like that. So it wanted to be more specific than would be hospitals. So that's change number 2. A third change, actually a third and fourth change, relate to the HIPAA piece that I just mentioned, that disclosure of information that's required in order to provide assurances that the patient, as it left here, the term was medically cleared. Right, remember that? So the change is to change that term to stabilize. And that's a reflection of stabilizing is the term that's used in health, that federal law, that is the law that actually says you can't remove someone from the hospital unless they are stabilized, is the word used. So to be consistent with the terminology, use that federal law. I think it's Emergency Medical Treatment and Labor Act, maybe.
Oh, good job.
Possibly.
Nobody else has been able to come up with
I
all
could be
this.
wrong. It's acronym. Sometimes it sounds like it should be fit, but maybe it doesn't really. I think that's close. And sorry.
Is it assumed that if they're stabilized, they're cleared?
Well, there has to be an affirmative statement provided from a hospital representative to the law enforcement officer that they're stabilized.
Okay.
So they have to get that statement before, and then in fact, the language, they even add language that specifically says they can't remove them until they get that.
Gotcha. Okay, thank you.
Yeah,
Stabilized, to me, says that they're medically stabilized. So where do you take them? If you take them out of there?
Well, then
If you take them out of a medical facility and they're there for a specific reason,
Yeah.
and you take them out, what do they do?
if they're under arrest, they could take them to a facility or a law enforcement agency for arrest. If they take them away for that reason, you know, they
So-
committed a crime, probable cause to believe they committed a crime, place them under arrest, can take them to, you know, local police station, law enforcement agency.
And they don't have any medical facility there to take care of them. So
Well,
if it-
If they're stabilized, then they're free to go. So the sense is, and there's actually been a number of changes here. Maybe we should look at the changes. So if they're stabilized, then they can leave the medical facility. If they require further attention, they'll have to be attended to. Yeah.
Yeah, they can't
Yeah.
remove them
Yeah.
if they're still, if they're not stabilized. And so, yeah, that is added to clarify that. And they also add, speaking of the stabilized issue, a definition of stabilized that's also based on this federal law and TALA. So it's clear both in the sense of what they can and can't do and what stabilized means is expressly put in the bill as well, based on that federal law. So those are the big picture substantive changes. There are also a couple of changes to the reporting pieces. They added a report on this. They want to get some data back on arrests that are conducted pursuant to this new arrest authority, but DPS, Department of Public Safety, said they didn't have the tools to provide the data right now. So they're asking for a report back from DPS as to what tools they would need to gather that data. And some other changes to some details on the report that left at the Senate as well. That's the big picture of what the changes are. We can take a quick look at the language if that would be helpful for.
Yeah, I think the key part for us actually is on the disclosure of protected health information.
Yes,
And it changed to hospitals. I did talk with the hospital folks about that change. And I think that they're fine with it. And all the testimony we heard was really we heard hospital-based testimony. We didn't hear testimony from long-term care facilities, maybe incidentally, but it was really ERs or EDs and hospitals. So, and then we also did hear about emergency personnel, EMTs being affected. So let's go to that section that there have been some language changes on page 5 of the bill.
yep, bottom of page 5. Where to
Let's
start.
look at that, and because it puts in the definition of emergency medical personnel, what's already defined in statute in Title 24.
Yeah, and it, as you're saying, Senator Lyons, the change here is to sort of reflect the federal EMTALA law and to shift over that terminology from medically cleared to stabilized to reflect that law. So if you look at the bottom of page 5, it is reformulated as a clear statement that when a law enforcement officer responds to an alleged crime committed by a patient at a hospital. Remember, so that's the very last word, bottom, remember, so it's hospital now, not healthcare facility. So when law enforcement responds to an alleged crime committed by a patient at a hospital, a couple of requirements kick in. That goes over onto the top of page 6. The first requirement is about this information disclosure, right? So number 1, authorized representative of the hospital shall disclose to the law enforcement officer the following information before the officer removes the patient from the hospital. So the officer can't remove the patient from the hospital until this information is disclosed. And there's 2 things there. A, information sufficient to confirm whether the patient is, you see the new word, stabilized. And then it adds not only, so the information not only to confirm whether the patient is stabilized, but whether they've been evaluated or is awaiting inpatient care, right? So there are these other statuses related to whether or not the person is going to be able to be safely removed or not. And that goes into subdivision B. They also have to disclose any other information that would be necessary for purposes of safety taking custody of the patient. You see, there's no change there. That was the way the language passed here. Then this prohibition is what you see in subdivision 2. So again, this kicks in whenever law enforcement officer has responded to an alleged crime by a patient at a hospital. What does this say in subdivision 2? Again, based on EMTALA, that prohibition I mentioned in the federal law. Law enforcement officer shall not remove the patient from the hospital if an authorized representative of the hospital informs the officer that the patient is not stabilized, has not been evaluated, or is awaiting inpatient care. So if any one of those conditions exist, they can't remove the person, even if they do feel that there needs to be an arrest. I think that responds to the question you had earlier. So what are the criteria for what the person's medical status is before they can take them away?
Thank you.
Subsection B, all the way from the middle of page 6 over on to the bottom of page 7 is exactly the same thing that I just described for emergency medical treatment providers. So it's the exact same, it's verbatim the same. It's just the person that it applies to and the situation it applies to is different. It's emergency medical treatment and at the scene where emergency medical treatment is being provided. So those are the two operative pieces for that, but otherwise it's the same. They can't remove them until they've been medically clear, until they've been informed they've been medically, stabilized, or if they're haven't yet been evaluated or awaiting care, can't remove them, and they have to be provided information about that before they can.
Can I ask
Go
a
ahead,
question?
go ahead.
I don't know if you'll know the answer to this, Eric, but in this, at a scene where an EMT may be responding, often police and fire also respond, and they're all there together, like a car accident or something like that. And if the patient is, or the person is acting, still needs medical treatment, but is acting in a threatening way, I'm pretty sure that it's already, I don't know if it's officially protocol, but it often happens where police will be in the ambulance with the person.
Right.
And this wouldn't prevent that. from
Correct.
The police traveling with EMT and just to make sure that safety of the EMT people in the ambulance, right?
Yes, that exact issue was discussed upstairs.
Okay.
In fact, it was brought, because one of the members of the House Judiciary Committee is a law enforcement officer, and he was talking about how they do sometimes ride in the ambulance,
Right.
and so they discussed that and agreed, and I agree too, that the language doesn't prohibit that.
Okay.
Yeah.
Great.
Yes,
You
sure.
did know that.
I know that one, sometimes you get lucky.
Don't ask another one.
Right. So just lastly, you referred to this as well, but that's where the definition of stabilized is as well. It's the bottom of page 7, lines 13 to 16. Again, based on the federal definition in EMTALA, means no material deterioration of the patient's medical condition is likely, within reasonable medical probability, to result from or occur during the transport of the patient from the hospital or the emergency medical treatment scene. So again, to reassure the officer that bringing the person away, whether it's for purposes of an arrest or whatever, isn't going to cause any deterioration of the medical condition. That's the idea. I forgot to mention, it's a separate subject, so I'll wait before I.
Any other questions on this? It seems like it's been good, seems a good extension of what we had put in initially.
Yeah, the judiciary change, I've heard about it, but.
Yes, that's what I forgot to mention. That's what I was going to mention.
Well, with the, I talked with senators here, so they made that huge change.
Right, one word.
One word.
And it is, if you look on your document that you're going to have, you turn back to page 2, line 20. This is the definition of disorderly conduct. So remember, one of the non-witness misdemeanor crimes for which this bill permits a law enforcement officer to arrest a person. Remember, there were 3: assault, criminal threatening, and disorderly conduct. And part of the disorderly conduct. So what happened in the House, and backtrack a little bit, what happened down here, you may recall, was the disorderly conduct statute was limited to a certain piece of it for which the arrest would be permitted. Remember, because there were other things like unreasonable noise, and there were other things that constituted disorderly conduct which you did not include. You only included disorderly conduct for engaging in fighting or in violent, tumultuous, or threatening behavior. The House struck the word tumultuous.
Yeah. Yeah. we don't like it
And
either.
Senate Judiciary Committee put it back, or was proposing to put it back in.
It's gonna
And that's
be
the
a
amendment.
tumultuous debate about that.
Well,
Yes,
because it's
that's
part,
right.
but because it's part of the definition of disorderly conduct, right?
Correct,
Yeah. And they
Okay.
didn't want to change the definition.
right.
Yeah.
And I just
Go ahead.
found it interesting that, it might be helpful just to understand a little bit about the background is that I checked out the Vermont Model Criminal Jury Instructions, because looking for a definition of tumultuous somewhere that is used in the criminal law, and what they use in the Model Criminal Jury Instructions for the word tumultuous is violent outburst or chaotic activity.
Or chaotic, I mean, I'm chaotic all the time, so.
Are you chaotic good or are you?
I mean, it
chaotic
doesn't say though,
No.
this is chaotic. I mean, you know,
Tumultuous.
I just, oh, well,
It's up to the jury, I think.
Okay, but they've debated it. We're gonna, that's judiciary's job. Well, go ahead.
yikes.
Senator
But
Richardson,
are you ready to start receiving feedback on the?
in a minute. Okay, just go to the last one is and then we'll get feedback. Go to the report.
Yep.
And then we'll come back to the.
Yes, well, one, you'll see there's some changes to the de-escalation report, right? See that bottom of page 7 over on the top of page 8? It just adds some detail, really, just with the stakeholders, it makes sure that it includes hospital employees, stakeholders, some specifics about the report to include adequate training, de-escalation of violent situations in hospitals, including staffing levels, ongoing assessment of visitors and patients for aggressive behavior, indicators to adapt care interventions and environments appropriately, centralized reporting, back to grade physical violence. So it's just sort of adding some detail to the report itself on de-escalation, some specifics that the report needs to address. And then lastly, section 5 is a new report. As I mentioned, that's from the Department of Public Safety regarding the new offenses in section 1 that permit non-witness misdemeanors to be arrested. And the Judiciary Committee upstairs was looking for some data on that. They want to know, well, how often is this going to be used? And who, where is it going to be used? What type of healthcare facility it's going to be used in? DPS said, we don't actually have the tools to come up with that data at the moment. So the report asked them to, it's phrased as, include any systemic or statutory changes needed to permit them to collect that data. Is what they're looking for, basically.
Okay, so Senator Weeks, you had a comment. Yeah.
No, general comment. So I certainly understand the EMT language, and that seems completely appropriate. But I don't understand changing from 2 hospitals only. I think we're leaving out a huge section of potentially vulnerable facilities. I don't get that bit. I'm wondering if anybody has insight into the.
Well, in my conversation with folks, and the House Healthcare Committee, I think it was, or House Healthcare Committee did weigh in on this. But beyond that, I think it was really based on the testimony that was heard, because the testimony wasn't about what happens in long-term care facilities. It wasn't about other places. It was really about ERs and hospitals. So there was an interest in confining it to what we had heard about. That doesn't mean that going forward, this can't be extended to additional medical.
Why not take the opportunity now? I mean, it came through this committee with that language about
Right.
medical facilities. Whether it's a clinic that handles ER type scenarios or a large hospital.
Clinics would be the place you'd want to look.
Right,
Exactly.
but this excludes it.
Go ahead.
I didn't hear the discussion in the other committee, but I think there was concern about it being broad, that it would, I think they received testimony from several groups that were concerned about it, people with Alzheimer's getting in long-term care facilities being defined by this in a way that was not appropriate. And that the focus has been so much on emergency situations and emergency departments. And that's where these incidents have happened the most. So trying to not create too broad of a net is what I think that they were doing. Because
It's also
it could
where
have
the
had
police
unintended
have been
consequences.
bringing patients. I mean, so it's really the presence of public safety that's also at those places. We could, you know, based on what we hear, expand it going forward. I don't think it will be a big step if we continue to hear that there are clinics or designated agencies and places where this type of violence is occurring.
I want
Yeah, no,
to lag this
we hear
down, but is it possible to at least get a little testimony from those that represent the larger picture?
No, where we are right now with this bill is, it was sent back from the House. It is a judiciary bill. We have taken testimony and informed the sections that we have. And we're looking at what the House.
Right, I get all.
Yeah, no, you
I
get
just-
that.
I just think.
So
that-
we're at
I
a,
think it's.
the answer is probably no. We're at a stage where additional testimony is complex, and I don't think it would serve us well at this point.
Yeah, I
Well, it'll serve us
appreciate that
well
they
in the
narrowed it
future. I
actually. I think
completely-
it's-
Yeah, I would like to have it be as broad as we sent it over, but you'll also notice that they've really changed the language in other areas, so I'm fine with it right now, and we can move forward. We can do more. Once people get used to the idea of the warrantless arrest and then allowing for patients to be removed once they're stabilized, once people are used to that, then it becomes a practice that we can extend beyond. This is a big expansion right now in this area for public safety to understand their role and for healthcare providers to be protected from violence. It's not just patients, it's others. You know, your point is extremely well taken. You know, what else can we say? I mean, how many people, if folks would like to extend testimony, we can do that, but I have a feeling it's gonna continue.
Yeah, no, I'm not trying to extend testimony. I'm just trying to understand,
Yeah,
you know, the logic of why the changes made. I think we were fine where we were 3 weeks ago.
we were,
You know, in
We were.
regards of
yeah,
broader look at medical facilities versus specific look at hospitals.
right. But then other testimony has been given in the House, and we've heard from folks, whether not we've heard directly, but those committees there have heard from folks and made changes. Go ahead.
So I was just gonna say, there were at least two of us on this committee that were uncomfortable with the bill and, you know, we're on the fence about whether we were gonna even vote on it. I appreciate that they narrowed it. I think that it's focused on the facilities and the instances where these kinds of, you know, outbursts are most likely to happen. And that if we see more situations, we can address them, but I think it could have had, I'm still worried about it having unintended consequences, so I'd rather start narrow. I mean, frankly, I think we should take disorderly conduct out, period. So I know, so there are things that I would like to even narrow it more. I agree with that, the expansion to EMTs, but so I'm happy that the House did what it did. So,
And I would just second what Senator Hardy said. And I would also just say that if there's one thing I'm learning this year is that a lot of this work is iterative. It doesn't happen all at once. And also, you know, when we do something like that, we're looking for an improvement, right? Moving forward. We're moving out of COVID. We're hopefully coming out of this time of crisis. And hopefully with this legislation and with, again, just moving out of the crisis that was the pandemic, we'll see fewer of these outbursts, and hopefully the problem will actually get better, and hopefully this will help it. But I also see that it's an iterative process, and we may need to change it in the future if need be. So anyway.
Okay, well, this is a bill that is up on the floor. We can, I would suggest that it's a straw poll, it's not a bill that's in here. So I would ask for sort of a straw poll on going ahead, and I will stand up on the floor and concur. Those who would like me to do that, and I'll include tumultuous in that, concur with the language that's come back. If you'd like to have that happen, then raise your hand. Concur with what the House has sent us. Okay. If you don't want to concur with what the House has sent us, raise your hand. Okay, good. But this isn't the end of this. We hear you loud and clear. We hear all of us loud and clear. Okay, good. That's done. Thank you.
You bet.
That's
I'm
great.
glad that was not tumultuous.
We're not.
That word, I don't know.
All right, well, thank you. We'll see you soon.
Thank you. Have a good
What?
weekend, Eric.
No. We can.
What are we doing on one?
We have 171, we have the proposal amendment that's back, and we can have Alex put it up on the screen, and then with what we had just gone through and agreed to. So we'll go through it, and then
Just to do a quick proofread, you mean? Is it,
we're gonna.
what draft,
Yeah,
what
it's on
number
our,
is it?
it's on our webpage, and now it's up on the screen.
Is it 3.1, Alex?
2.1, I believe.
I don't think so. I think it's
I will
it's
tell you
3.1
what it
because
says.
there's,
It says 2.1. That's what Katie sent me.
oh, 171, sorry,
Yeah.
2.1.
wrong
Got
bill, 2.1, you're right.
One of three.
My
Okay, great.
apologies, Alex.
So
Just want
looking
us
at 171. Senate Health and Welfare Proposal of Amendment, draft 2.1. Then I've got the wrong bill up. Hold on a second. Draft 1.1. So we have.
Draft 2.1.
I said 2.1, I'm looking at three different.
Is it
things.
on the? what-
It's on
Yes,
our
it is.
webpage, yeah, it's draft
I don't think this
1.1,
is right.
H
actually. Really?
171.
Not right, yeah,
Oh, no.
So,
Why? Where
Let's
are you-
go through
how
it.
can you tell?
What do you think is
because I'm
wrong?
looking at the language. Under the language that she was going back and forth with on in the third instances of
Okay, let's go
amendment.
through each amendment first. So first, we're striking negligently or negligently and putting or before the word recklessly. Secondly, we're striking or negligent and putting the word or before reckless. Third, we're having a person with a designated responsibility that changes that definition,
It doesn't,
and it moves.
Caregiver?
it doesn't include designated. So what she did
I'm
was.
looking at the third proposal amendment, and it says, C, a person with a designated responsibility providing care to a person that is required because of the person's age or disability. I'm on line 15 of page 1.
Line 15,
Mhm.
Caregiver means? That?
I think you're on.
you're on the
draft,
wrong,
Madam Chair.
you're on the wrong,
You're on draft 1.1.
yeah,
Oh.
there's,
I'm
that's all
sorry.
struck.
That's why I said 1.
Yeah, it's 2.1 and that,
Oh. I don't
this
even have it.
instance, the third instance of amendment, when she, the
Uh-huh.
A is a worker or employee in a facility, that one is correct, but then she didn't include a person as a designated to provide care to a person.
I don't think the designated was in there.
It was supposed to have been.
Let's look. What was in 1.1? Let's just compare. We may be absolutely right. What we'll do is,
1.1, line 15.
that's the definition, but you're looking at the which instance of amendment?
The third instance of amendment in in 2.1, we discussed,
Yeah.
you know, creating just two because A and B were
Right.
redundant. But I think the
Right.
department was saying they were trying to
Yeah.
narrow it and make sure that the
Yeah.
word designated was in
Not
there and
there.
it's not there.
So we'll have to have Katie correct that.
Yeah.
Alex, you want to send Katie a note, tell her it's that on page 2. On page 1, 2, page 2, line 4. It's supposed to say something, it's supposed to have the word designated in it.
Yeah, and I think it's supposed to be,
A person designated to provide care. But we need to have that.
designated to provide care to a person that is required because of the person, that's gonna be confusing.
And we're down to like, yeah,
That
8
B,
minutes.
big B, line 4 needs correction based on our discussion in committee.
And it's also gonna be unclear because there are gonna be 3 persons, and so it's unclear which person
Right,
is
that's been the
referring
problem
to
from
whom.
the beginning.
Yeah, so that needs to be reworked.
But it says to a person, yeah, no, she's gonna have to fix that one. Okay, but then let's go on to the 4th. Okay with that. And the 5th. And then 6th. 4th. And 7th. And then that's the HIPAA. Okay, so what here's what we will do. I have a question of you. We could do what Katie has said and vote on it in principle and then look at the final language to confirm our vote. I can get a hold of it, can have it up on the floor and in the corner. Or we can just hold off and do our vote at that point. So that's a choice, but I want to make sure we're all there so we can all vote.
I don't feel comfortable voting on it until we see it, because
You want to
especially,
hold off? You wanna hold
especially
off?
given
Would
that-
you like to hold off?
I don't need to hold off if you wanted to get things moving, but I can.
I mean,
Senator Weeks? Senator
Well,
Weeks?
I see the logic in holding it.
I don't care.
I don't, my sense is
Okay, all I
not,
can say is this, if you're not there, you don't vote. I'm just like, I'm gonna say, we're meeting in the corner, or we're taking a break to meet in the
I don't
corner.
think we
I'm
can do
gonna-
that. We have
we
to
have
vote
done-
on the record, and,
We do, we will.
well, just so you know, I'm gonna vote against the amendment, because there's that line, the one instance of amendment that I disagreed with, so I'm voting against
That's
the
fine.
amendment,
You
but
don't have
for
to
the
vote.
bill.
Well, now you're voting.
But,
That's
no,
okay.
I'm just telling you, so
Okay.
you are not surprised,
So
Madam
here's
Chair.
what we might have to do, because Senator Hardy is right. We're going to have to come down here and vote online.
what's the urgency to not hold till Tuesday?
Because we're running out.
Senator Hardy will not be here on Tuesday.
You can vote without me on Tuesday, it's fine. I mean, I just told you where I'm at with this. and-
Okay, we'll go for today. If that doesn't work, we'll do it Tuesday. I'm not gonna push it.
I'll be available if you guys want to meet after the floor.
Yeah, good.
Whatever works.
Okay, we'll try that.
Depending on how long the floor goes, we might have some time between
Yeah,
that and. afternoon
so
meetings.
right now, let's meet here
Okay.
after the floor.
Okay,
That's what-
sounds good.
Okay, good.
You should come in Monday.
No,
You come in tomorrow.
no, I'm going to funeral, that's not fun.
Oh,
Okay, all right, good. So that's good. Thank you. This is very helpful and
Just to clarify for Katie, it's just the page 2, line 4 issue with
It's the-
designated provider.
yeah, tell her it is, don't even worry about it. It's the 3rd instance of amendment on page 2, big B. And I'm happy to talk with her about it. Designated, person designated, is not there.
are we doing anything right now with the appointments?
Yes.
Okay.
All right, let's move to appointments.
This will
Oh,
only
you know
take a
what?
second. Only take a second.
A second, okay.
So this is just an overview, see update to the matrix.
Gosh, I love how organized
So
you are.
organized.
So what I want to highlight,
Sorry, you
Spreadsheet
guys.
this.
there's only 3 outstanding nominees. And going down to Board of Medical Practice, we're on the bottom, David Kader, that's me, I took it. And then in Children and Family Council Prevention Services on the right, the last one, Julia Brand, that's me. I've got a hold of these guys, but we're just trying to arrange a time. And the child, youth and family advocate, Senator Williams, that's you? That's Matthew Bernstein. Does that ring a bell?
Yeah, he was in here,
Yeah.
came in, we met with him.
Okay. Can you make sure he's got contact info?
Yeah, well,
Yeah, that's it. Otherwise, we'll clear the, the
Yeah,
vast
today
majority
we're
of this.
gonna do a bunch on the floor,
Yeah.
so excellent.
Hopefully.
That's it.
Thank you.
I like your color coding. I appreciate it.
Yeah, it's really, really helpful.
You're obviously
This
good
looked
with
like my
spreadsheets.
Excel spreadsheet.
Yeah, this was an Excel. I mean,
No,
this
it's
is.
PowerPoint.
Well,
Yeah, this is
but
PowerPoint.
either way, it's nice. It's nicely done.
Are we offline?
Now we're offline,
All
please.
right.
We're not adjourned yet, but we're offline.
Well, I can